Alright, so we did our presentation over Anastasia. She has a case of extreme dissociative amnesia, and this was done by Katharina King and Ashley Johnson. So the patient is Princess Anastasia. She is an 18-year-old girl. She was the youngest daughter of the Tsar Nicholas II, who was royal Russian royalty. She witnessed the execution of her family during a siege on the palace whenever she was young, and in the midst of her own escape, she fell and hit her head and consequently lost all of her memory. So we diagnosed her with general dissociative amnesia. It's in the DSM-5 category of dissociative disorders. The first symptom that she presents is generalized amnesia. She has a complete loss of her past history and personal identity, and she can't recall important information about herself, such as her name, age, or childhood. She doesn't tell the woman who runs the orphanage or her traveling companions because she just can't remember. Her second symptom is that she experiences flashbacks in certain situations. One of these, an example of this is whenever she arrived back at the Romanov Palace, she experienced vivid flashbacks of the last party that was held before the siege. So missing symptoms from Anastasia is that she doesn't have any history of self-mutilation or suicidal thoughts. Many individuals of dissociative amnesia can't form stable relationships, but from what we observed of her social interactions, she's able to create satisfactory relationships, as seen with Dmitri and Vladimir during the course of her travels. And also, unlike many reported individuals, she is highly aware of her amnesia and doesn't shy away from confronting her memories. So for treatment of dissociative amnesia, there are two main stages of psychotherapy, one of which is to create a safe and comfortable environment where the patient can feel supported by her psychiatrist or family or friends. And then once that is accomplished, then the second stage commences, and that is to confront the source of the amnesia or the traumatic event and undergo cognitive integration of the event with her personality. So this treatment we found to be appropriate because in order to safely unlock her missing memories, the patient has to feel at ease. She can't be scared or uncomfortable. And we didn't find any ethical concerns with this type of treatment. For medication, according to the Encyclopedia of Mental Disorders, there isn't a medication yet that can cure or prevent dissociative amnesia, but sodium amytal is sometimes used by psychiatrists to assist with treatment if the psychotherapy doesn't succeed by itself, and it's just a mild sedative. It helps to calm the patient down or induce a hypnotic state so that they can help to access their memories. The prognosis of dissociative amnesia is pretty good. Many recover their memories by themselves in time or with family and friends. Anastasia's own success actually ends up being based on the state of her environment and how much stress the traumatic event placed on her mind. So the movie portrayal of dissociative amnesia was accurate in some places, but not completely. The movie lacks the portrayal of Anastasia's personality change, something that should happen, or it does happen with most patients. A brain injury along with severe emotional trauma can cause amnesia. However, Anastasia still displays normal social interaction with only slight depressive tendencies and no sign of suicidal thoughts. And also, the 12-year prevalence of her amnesia is extremely rare. Most patients don't go through a period of 12 years where they can't remember anything, and then all of a sudden, in a matter of weeks, they just kind of magically recover all of their memories. So her instant memory revival is highly unlikely. Our main issue with the movie is that it allowed the public to make light of the effect on personality caused by amnesia. Everybody kind of got their happy ending, and the conflict resolved itself very, very quickly. We just didn't find in our research that happened with a lot of patients. The timeline looked a little bit different. So anyway, that's our presentation. Thanks for watching.